Very good morning to all. Today we will discuss regarding the new topic that is the anatomy and physiology, that is review of reproductive, that is over in the last lecture. So that's combined a topic of MSN and OBGYN. Here that's the topics they are dealing, that is comes under your medical surgical unit. This is female reproductive disorders. So under that the important topic, that is the breast self examination. In short, it is also known as BSE examination. Okay, the name itself suggests that is a breast means that is assessment of the breast, that is a self, means it is done by the woman or girl by themselves. No any other healthcare provider or any other persons, they will do the assessment. Only the person will do the assessment by themselves and examination. The examination the it includes inspection and palpation of the breast. Okay, so that is a breast self examination. Now definition of breast self examination. It is a screening method. Screen means it helps to identify, or it is used in an attempt to detect the early breast cancer. Okay? The breast cancer is a wide problem nowadays. So VS is the techniques that has been developed that it helps to detect early cancer. Means in early stage it can be detected and the woman they can have the surgery. The method that involves the woman herself looking at and feeling each breast for possible lump, distortions or the swellings. Okay. So the breast self-examination is only include two techniques, that is looking means that is the inspection, and feeling that is a palpation of each breast means we need to assess for the both the breast for possible any lump, distortions or the swellings. Okay, a breast self-examination, it's a checkup a woman does at home. Okay, the woman or girl they can do at the home to look for the changes or problems in the breast tissues. Okay, it can be done so that we can note any changes, any problems in the tissues. Many women they feel that doing this is important to their health. Okay, some conscious girls and women are there that they are following the steps of breast self-examination at regular interval and the time. So what is the best time during which we can do the breast self-examination? That is the best time to do a monthly self-breast examination is about 3 to 5 days after the periods has been start, means 3 to 5 days after the menstruation is a best time that uh, during which the girls they can do a breast self examination. Next most important thing is a woman they need to do this examination at the same time every month. Keep so they need to fix one date. During that date, they need to perform the breast self examination. The breasts they are not as standard or limbs at this time in your monthly cycle. Okay? Because in as you know that the hormonal changes that takes place under the menstrual cycle. Okay, so there are sometimes tenderness in the breast, the pre menstrual syndromes will be there. So after the menstruation, that is 3 to 5 days, it's a very good time during which there will be no tenderness, no any limbs or lumps will be there at the breast. So we can easily detect if any cancerous tumors, any other tumors is there or any abnormalities can be there. What will be detected or what will be screened? So breast self-examination, it can help to screen for any tumors, cysts and other abnormalities in the breast. Next, preparation. What we need to prepare? First, we need to prepare the timing. The best time to do a breast self-examination a few days after your monthly menstrual cycle. It ends, as we have discussed, it is 3 to 5 days after the menstruation. The hormonal changes can affect the size and filling of the breast. So it is best to perform the examination when the breasts they are in their normal state, and that duration is about at the end of the menstruation. When who does not menstruate should choose a certain day to perform the examination. For example, first day of each month. If, for example, in sometimes the women who have the menopause, they are not having the menstruation, so they can do it one fixed day of the month. Everyone should also keep a journal of your self-examinations. Means we have to note the findings of the self-examination of the breast assessment. This will help to track and record any changes that has been noticed in the examination of the breast. So if any changes is there, any lump is there, then it can be noticed and it will be helpful for the early detection. Now the steps of the breast self-examination. The techniques which are followed, that is mainly two techniques, inspection and palpation. So first, in each and every examination, first we need to do inspection, then we can go for the palpation. Okay, so inspection before a mirror. Okay, so woman should stand and face a mirror with the arm that is relaxed on your sides or arms that are resting on your hips. Then turn to the right and left for a side view look. So in the diagram, you can see that a woman that stands in front of the mirror with her hands on the hips. Then she can turn right and left to know that if any sides way curvature abnormality can be seen. Okay, next, bend forward like this. You need to bend forward from the waist with arms there rise overheads. The arms will be raised overheads. Stand straight with the arms rise over the heads and move the arms slowly up and down at the sides. Look for the free movements of the breast over the chest. Okay, here that's a bending, and here the right hands will be up, and she can do a movements, or she can visible a free movements of the breast over the chest. Press your arm firmly together at the chin level while the elbows they are raised to the shoulder level. Okay, so here the arms they are at the chin level press and the elbows they are raised to the shoulder level, so that easily the visualization of the breast can be possible. Okay, so this steps the 4 and 5. They need to perform in both position, that is a standing position, and second there is a lying down position. Okay, so how we can do that is place a pillow under the right shoulder and place the right hand behind your hand. So like this, the diagram can be seen that a pillow is placed under the shoulder and the right hand is behind the head. This position it distributes the breast tissue more evenly on the chest. Use the finger pads here. That part is known as the finger pads of the three middle fingers on the left hand to fill the lumps. Okay. Next, press the breast tissue against the chest wall firm enough to know your breast fills. Reach of firm tissue in the lower curve of the each breast is normal. In the lower curve is like this. So normal. A circular motion symmetrical all the way around the breast as many times as necessary until the breast is covered. Means they need to cover the whole breast in a circular motion. Okay, upward, downward, in the nipple and surrounding and the rest. Bring your arm down to your sides and fill your armpit. Okay, so armpits there also needs to be assessed where the breast tissues they are also located. Repeat the exam on your left breast using the right finger pads of your right hand. Means the same steps that must be followed on the both breasts. So clear the examination, that is a pillow should be placed, hand must be under the heads, and the finger pads this portion that is used. First we have to start for center to periphery and whole breast should be covered. Next, pay special attention to the area between the breast and the underarms because they are also connecting and they can also have the breast tissues. Gently squeeze the nipple and look for a discharge. With the help of any cotton material or cotton, there must be a squeezing of the nipple so that if any discharge is there, then it can be noted. And if the discharge is there, then woman need to consult a doctor. During the pregnancy, there is no need to do a breast self-examination because the breast is undergone a certain physiological changes during the pregnancy. Step 6, that's nothing but the 4 and 5 repetition in the standing position. Next, contraindication, in which situation it is not to be done. Then a prior history or existing history of the breast cancer. Means if any woman they are having history of the breast cancer or endometrial cancer, then they don't need to perform a breast self-examination. Any prior history of venous thrombosis, then it must be contraindicated. Undiagnosed abnormal vaginal bleeding means if heavy menstrual bleeding, very scarred bleeding is there, so it is contraindicated. Severe active liver diseases with uh, abnormal liver function test. And a relative contraindications, that is family history of breast cancer, hypertension, gallstone, and gallbladder diseases. Now the terastutums, absolute contraindication and relative contraindication. Absolute, that is the woman they compulsorily don't need to do a breast self-examination, and relative they can do but with certain risk. It will help for the awareness regarding the breast self-examination among the young generations. It is very useful and it is most important a viable tool for the early detection of the cancer, as the cancer is the second leading cause of mortality and morbidity in both developed and developing countries. So prevent this morbidity and mortality. Breast self-examination is very important. And in the last summary, how we can remember the breast self-examination, that is most breast cancers they are detected by the woman themselves. So teaching of the breast self-examination early, so it's become habitual. Essential components, that is a 7 P's, that is a position, palpation, paid of the fingers, pressure, parameter, pattern of search, and patient education. Okay, so position, that is mostly two positions will be used, standing position and lying down position. Okay, palpation, that is the with the help of the fingerprints the breast needs to be palpated. Next, the pad of the fingers. Okay, so pad of the fingers, that's the area that is used for the examination or palpation of the breast. Next, the pressure. During the palpation, a woman needs to apply some pressure to detect any lymph or any tumors. Next, parameters means they need to cover the entire breast. Pattern of search means in a circular motion. They need to do a examination. And lastly, the education of the patients for any abnormalities and how the detection can be there. Thank you.